everyone. Again, I'm Patty. It's welcome to be here. I'm such a proud member of the Revital Cancer Rehab Program in NovaCare. I've been lucky to work in the Maryland, DC area for 15 years now, and I've always been interested in working with oncology and exercise. And I was just lucky enough to let this kind of blend when I found this profession. So I'm going to kind of go through a little bit of some of the research and some of the education, and we'll talk about a case. Feel free to put some questions or things in the chat, and we'll stop at the end. Let's get going. So what are we going to talk about tonight? Well, we're going to look at what is cancer rehab. Is it something that might be appropriate for you? And what is some of the research saying, some of the emerging, looking at how does cancer rehab potentially help individuals affected by cancer? Then we're going to use a case study of a patient that's been seen in our area so that you kind of can learn a little bit more about what to expect during your own cancer care journey. And then we're going to end with highlighting one of our really specialized programs for individuals called our Strength After Breast Cancer program. And this is a great program that can be utilized throughout the cancer care journey, but is mostly used after you finish active treatment. Well, we're going to be discussing with the lens of breast cancer. I do want to make note that most of the principles discussed today would pertain to all cancer types. So what is cancer rehab? Well, cancer rehab is a process that helps cancer survivors obtain and maintain the maximal physical, social, and psychological and vocational functioning within the limits created by cancer and its treatments. And that may sound like a little bit of a mouthful, but what we're going to do in the next few slides is we're really going to kind of dive into what does it exactly mean and why can patients benefit throughout their cancer care journey. So why cancer rehab? Well, the studies show that 60 to 90% of patients affected by cancer have at least one need for specialized rehabilitation. But there's a gap in those who may benefit from and those who receive. And that's why it's so important to advocate for yourself and be able to kind of determine, are these things that I'm struggling with, is this might be something that might help me live my best life? So who delivers the care with cancer rehab? Well, many people can be on the team. It can be a physical therapist like myself, an occupational therapist in some settings, a speech language pathologist, or a PM&R doctor, also known as a physiatrist. We all can work in different mediums to help individuals affected by cancer with their pain, function, and helping reduce risks of functional decline. Within that, you may also see an individual who might specialize in pelvic health, lymphedema, or cognition, or sometimes you may even see a person who might specialize in all three. So let's look at some of the emerging research of cancer rehab in the literature. When I first started, even 10, 15 years ago, the idea of being active during active treatment and doing physical therapy and looking was still kind of not a typical thing. But what we've seen in the literature is that there's a lot of benefits. So the Revital National Team did a retrospective study looking at 4,000 cancer survivors. And they looked at 13 different diagnosis types. And what we found is that the majority of individuals, when they first came into their evaluation, had significant limitations in their function. That could be them getting up out of a chair or getting up off the floor or being able to go to the grocery store by themselves. It could be being able to watch their loved one or a grandchild. Or it could even be that they're feeling like they're mentally not as sharp or feeling as emotionally stable as it maybe were. What we did see, though, was that with cancer rehab, we were able to improve on all of these measures that our social functioning, our ability to participate in things that matter to us, our physical health, our physical function, and our mental health improved. When we specifically looked at breast cancer in a group of individuals above 65, the National Revital Team looked at what kind of issues were these patients coming in with. And what they found was these individuals had muscle weakness or felt more fatigued or atrophied. They had limitations with how well they could raise their arm and stiffness, and some reported lymphedema. What we found was is the individuals again improved in their physical function, mental health, their ability to do self-care in all domains. So if they had physical or occupational therapy. We also found that age dependent wasn't looking at the results. So an individual who was 65 or an individual that was 80 still made significant improvements. This year, we came out with a research study looking at individuals who have had breast cancer who are working age. And that doesn't necessarily mean that they are working out of the home. They could be working in or out of the home. But we want to look at younger individuals and see what kind of difficulties they're having and if cancer rehab could help. Again, we saw similar concerns: upper extremity tightness, pain, weakness, lymphedema, and fatigue. And then we looked at their person's workability index. And that really means is how comfortable would they feel with being able to go back to work physically and mentally. And what we found was that at an average of 12 visits, these individuals were able to improve on all of these measures. They were able to have more mobility. They were able to return back to work. They felt more confident doing the types of activities they were doing prior to breast cancer treatment. And this is huge because we know that our occupation or our role in our family, that being able to be independent with that is so directly related to our quality of life. Lastly, I want to go over a little bit of research specifically looking at breast cancer, highlighting the fact that individuals could have symptoms right after treatment or during treatment, but could even have symptoms way on 2, 5, even 6 years after they've had cancer treatment. So what we're going to do now is we're going to switch gears a little bit and we're going to look at a patient that was seen at one of our clinics. We're going to kind of walk you through their journey. For today's lecture, we're going to call this patient Sunshine because she just beams sunshine and a true motivation to all individuals that are affected by cancer. Her can-do attitude and her will to live was incredibly inspiring. This individual was diagnosed with breast cancer in 2021. She had chemotherapy, a bilateral mastectomy, and then had chemotherapy again, and then finally had radiation. And so what we're going to do is kind of walk you through a little bit with her journey and kind of touching on some things that might have been done or some things that might be done when individuals are on that certain step of their breast cancer journey. So prehab it's the idea of evaluating an individual and looking at where they are at this moment before cancer treatment. Okay. They may have limitations because of the cancer itself. They may have limitations secondary to previous injuries or occupations. And so what we like to do is we like to take baseline measurements, check their range of motion, look at their mobility in their neck, see how well they get up out of a chair, see how, if they have any risk for falls or how are they walking, and really make an individual specific plan that's going to best fit their journey and what they want to accomplish. So often we'll then record these, we'll send them to the doctor and we'll educate the patient. We might give them, here's some exercises to do before you have surgery, or here's some exercises that would be really helpful for you to do while you're going through chemotherapy. Here's some things maybe you want to look out for. You know, if you start to feel some more numbness and tickling your feet, I want you to let the doctor know. You know, if you're starting to feel like you can't get out of bed or you're feeling a fever, here's what to know. And then kind of talking about symptom management. What are some things that you can do to better yourself? And also what's some things that we can do to make our lives a little easier. Luckily, we're in technology, Uber and Uber Eats and getting our groceries delivered and things like that for some individuals can really help out. But this is also often the time where I really say, who is your team? Who's your care team? Who are the people who are asking how they can help you? Let them help you now. We often will help educate people with what to do right now and what to do later, and then when to come back. I want you to come back 2 weeks after surgery. I want you to come back 4 weeks after surgery, or I want you to do these exercises while you're going through chemotherapy. But if you start to have some other issues, I want you to let me know. Okay. And when we looked at the data and the research, what we found is that individuals who came in before prehab, so before treatment, their energy and strength didn't decline. And actually, it was able to bounce back even faster. Now, if you're listening to this and saying, oh, why didn't I know about this and things, don't fret. We also seen in the literature that individuals who might be seen after surgery or after treatment make excellent improvements in their quality of life and function. But I'm so tired, or I'm going through treatment, I can't imagine adding exercise onto my plate. And I think to the point, I think that's a real feeling. I also think it's very dose dependent on what type of treatment you're having, what your baseline function was. But when we looked at some meta-analysis looking at physical activity and exercise during active cancer treatment, we've seen some excellent benefits in function. We've seen that individuals who exercise regularly had 40 to 50% less fatigue than those who were active. We found that exercise helps improve mood. It can help with depression and anxiety that often can go hand in hand with any type of cancer diagnosis. We also found that individuals who stayed physically active slept better. And we're also seeing that they had improved blood counts and even the ability for them to complete their chemo as prescribed. So when you're going through treatment, it is safe to exercise. How aggressive you do is really dependent on your condition, your treatments, and how you're feeling. But even some moderate aerobic activity and some light weights can do a lot of good. So our sunshine, she got evaluated. We educated her on some exercises to perform. We told her when to come back. We gave her some things to do for her balance and her strength. And then she came back to see us 4 weeks after surgery. And then we reevaluated. Because we have these numbers, we're able to see, okay, you were here before, and here you are now, and here's where we want you to go. So again, we make a very specific individual plan and frequency to help match the best needs for our patients. So what are some typical symptoms or side effects that you may expect during your cancer care journey? And what does rehab actually do? I get that question a lot. So I thought I'd go over a little bit with the lens of what we did when we worked with Miss Sunshine. So pain can become from the cancer itself. It can be caused from surgery or chemotherapy. So we work on breathing techniques and mobility. We work on aerobic exercise and light weights to help with our fatigue. We do stretches in the morning and throughout the day to help with stiffness and tightness. We educate on an individual's risk for lymphedema. And with early intervention, we provide exercises and activities. We can work on incontinence or kind of pelvic health issues. We often work on balance and strengthening our fingers and toes, which can help with numbness and tingling. We always look at how a person walks and see if there's ways that we can do to make it more efficient and less discomfort. And then we really focus on what are the type of activities that you want to do. For Miss Sunshine, it was really important that she could still help be a caregiver to our family member. And so a lot of the work that we did was working on her endurance and stamina so that she could safely help physically with her caregiver without hurting herself. And that varied a lot throughout treatment. And then finally, this is a picture of Miss Sunshine after finishing radiation. And And I could totally imagine after everything that she went through, she'd be ready to just say, all right, I'm done. Give up, no more rehab for me. But she didn't say that at all. She actually said, I want to get stronger. I want to be stronger than ever so that I can maximize my strength and energy to help take care of my caregiver and be my very best. But one of the common symptoms that can happen after all this treatments is fatigue. I find it to be one of the most limiting of all the impairments, because when you're tired, it's hard to exercise, which then makes it harder to sleep, which makes it harder to do your activities, which then makes you stressed out because you didn't get anything done. And it can be just this vicious cycle. But we know what can help us. Cancer rehab and exercise has profound improvement in cancer-related fatigue. And we also know in the evidence that exercise and physical activity after cancer treatment also has many benefits. It again improves physical function, endurance, and strength, bone health, improves your weight control and your quality of life, and again can help with depression, anxiety, and stresses that often will be highlighted. And this is huge because we actually are seeing that individuals who exercise actually have a decreased risk of cancer reoccurrence, decreased risk of mortality, and increase independence into activities that matter to them. So as we switch gears, kind of, you might be someone, or you might know someone who has already finished active treatment, and still is looking for, how can I be my best? You mentioned that I should exercise. You mentioned that I should do weights. How do I do it? What's safe? What's not? I don't want to get lymphedema. What do I do? Right? So we have on the Revital Cancer Rehab website, there's a great presentation called Strength After Breast Cancer. And I borrowed a few of those slides today. So I'm just going to highlight just a little bit of this program that is used to help determine if there's any current lymphedema, to screen for lymphedema management needs, and to help a patient know how to slowly develop an exercise program that's going to be safe and helpful for them. It's fantastic. It really, to me, is that cue that really helps us get from active treatment to survivorship in a way that we can help do the recommended exercise. So what is it? So it is a program that is backed through research, backed through the PAL trial, and it is a supervised training session, 4 to 6 visits, where we are going to meet with you. We are going to find out what your risks are, where your needs are, where's your baseline, and slowly and steady progress you in stretches, strengthening, aerobic, some core, some balance, and how to do it at home. It is safe. The evidence has shown that individuals decrease body fat, they improve their strength, they improve their stamina, they improve how they feel about themselves. We are seeing dramatic decreases in the likelihood of developing lymphedema and dramatic improvements in the likelihood of exacerbation if you already have lymphedema. Some of the medications that some people are placed on after breast cancer treatment can sometimes impact our bone mineral density. So these exercises have been shown to help improve your body mass, your bone mineral, and make your bones stronger. It's also designed to be something that you could do at home or at a gym. So it's very cost effective in that this is something that's really designed that you could then do this independently. So exercise to manage lymphedema, we kind of talked about this, but I just wanted to highlight it again because that's often a hot topic. Exercise can help reduce lymphedema. It's done by doing range of motion. It's done by upper body resistance. It's done by weight management. And it's also done by frequent screens by a cancer rehab professional. So what is the Strength After Breast Cancer program, also known as the SABCs? So what it's designed is initially it's a warm-up. Okay, so you'll warm up on a bike or a treadmill, arm bike, swimming. Then you're going to do a full body stretch. You're going to stretch your arms and your legs and your back. Then we do core strengthening to help make our back and our abdominals strong. And then we transition into a strength program where we alternate arms and legs and arms and legs. And we do that by slowly increasing the weights to start to build our confidence and independence, and while also monitoring for any arm swelling or any discomfort. Okay. What's so great about that is through that kind of 4 to 6 sessions, we then can monitor your symptoms, we can take measurements, and we can kind of say, is it time to progress? Is it time to make things harder? Is it time to take a pause? Is it time to go down? And then if you do take a break, what to do? And then finally, we do cool down stretches to kind of stretch everything back up. So in conclusion, cancer rehab is helpful throughout the continuum of care. We can see individuals by doing exercise and kind of the preventives. Once an individual may be diagnosed with any form of cancer, cancer rehab can be done proactively, where we're taking measurements and looking to see where are you and what road do you need to go and how can we help you be your very best. We can help with symptom management during the active treatment, be immunotherapy, surgery, chemo, radiation. And then we can help you in survivorship or palliative care when we're looking at how can we support the existing structures, how can we help restore function, and how can we prevent further injuries. I'm going to play this in one moment, but I'm just going to finish the slides and then we'll go back to that. If you want some more information about some of the other topics that we talked about, I highly encourage that you check out revitalcancerrehab.com, our Living Well Beyond Breast Cancer series. It is fantastic. It goes into cancer-related fatigue and goes into strength after breast cancer and lymphedema in a much more detailed fashion, and it has incredible information. It also helps if you're looking to find a cancer rehab specialist near you. You can put in your zip code and find that as well. If you have any questions, feel free to email me. Again, I'm Patty Horning. Happy to see you if you're in the Maryland, DC area, or happy to connect you with some of my colleagues throughout the country. They're a great team. And then reaching out for support. I mentioned the Revital Cancer Rehab, talking to your healthcare provider, having that conversation. Do you think cancer rehab might be helpful for me? Do you anticipate any weakness, neuropathy, or fatigue? And then kind of having that bridge of what to do. And then lastly, the American College of Sports Medicine came out with some pretty powerful position statements on exercise and cancer. They even developed a whole website called Exercise is Medicine. It has fabulous information. Their website is easy to use, and they have great flyers and brochures. So great additional resource for you and your loved ones.